Hey, Mr. Willie, are you ready for your medicines today?
Yeah.
Yeah, you think we can take them real quick? Okay. Now let's look. I have these 3 syringes right here. Which one do you want to take first?
The little maid.
The little one? You want to take it by yourself? Good. Make sure you swallow it. Now which one? This one? Okay. Good job. Do you need some drink? Take a big drink real quick. Oh, it's okay. Last one. Good job. Now this medicine, you can keep holding your drink. This medicine is in this applesauce because it was a pill we had to crush up. So let's just eat the applesauce. We'll get all of it out. Good job. Drink some of your drink. Good job. High five. You did great. There are different sites that you can give injections in pediatric clients. For subcutaneous injections, you can give the injections in the fatty area above the tricep muscle on the back of the arm, or in the fatty tissue in the thigh. For intramuscular injections, we like to use the deltoid or the vastus lateralis muscle. For children who are less than 3, the vastus lateralis muscle is the preferred site. For children who are at least 3, you can go ahead and start giving injections in the deltoid. And we have to wait till they're at least 3 because we want that muscle to have adequate muscle mass before we start injecting drugs into it. You can still use the vastus lateralis for a client of any age, and you can decide which site is more appropriate based off of the drug you're giving. Now I'm going to show you how to find the landmarks to give an injection in the deltoid. This client is 6 years old, so he's old enough to get the injection in the site. We'll also look at his muscle and make sure it's well developed enough to receive an injection. All right, buddy, sit up straight for me. So when we're looking for a place to do the injection, you want to locate the acromion process, just as you would on adults. Now, you have to kind of use your own judgment and see if 2 finger breadths or 3 finger breadths would be appropriate. For this client, 3 finger breadths is going to put me way below the most developed part of this muscle, so I'm not going to go that far. If I use 2 finger breadths, I'm right in the middle of the most developed part of the deltoid, so that's where I would do my injection. Now I'm going to show you how to find the vastus lateralis landmark in a pediatric patient. You're going to use the same technique as you do for an adult. So I'm going to put my hand on the greater trochanter and the top of the knee. Okay, then it's going to break the thigh into thirds. I'm going to look in the middle third section and go to the lateral aspect of that muscle, about right here. If you're having trouble visualizing the muscle, you can have your client lift their leg up and you can kind of see the outline of the muscle when you're looking at it that way. This is the bear hug technique for injections. It's really helpful because you can put the child's arm under yours and then they have their legs wrapped around you. So as the nurse or the healthcare provider, you can easily access the deltoid while the child is immobilized. They can also easily access the vastus lateralis muscle while we immobilize the child this way.
Okay.
Another technique for holding a child for injections is like this. You can hold the child in front of you, holding their arms down. You can cross your legs in front of them. So this keeps them nice and secure. Gives you access to the deltoid and the vastus lateralis.